Good morning, everyone. Thank you. My name is Marwa, and I'll be presenting part of our work. I work with the Kenyatta National Hospital with the PrEP implementation programs. So a brief introduction to what influenced our analysis is adverse childhood experiences have a great health and impact to the health outcomes later in life, including sexual behavior, and few data exist on the relationship between ACEs and behaviors associated with HIV acquisition. And for this, we evaluated the relationship between ACEs, HIV risk, PrEP uptake among pregnant and postpartum women who are participating in a PrEP implementation studies in Kenya. We included data from a PrEP implementation study, which we call PRIMA. And within PRIMA, we're enrolling pregnant women, and they were being offered PrEP they're being offered PrEP either during pregnancy or postpartum. And the women were followed all through 9 months postpartum with HIV testing, regardless of their PrEP status. For our analysis, we identified correlates which include HIV risk scores, which we evaluated them using a HIV risk score tool that was developed by Pintia et al. You can find at Pintia et al. 2017 to assess HIV risk scores, and scores above 6 denoted high HIV risk. And for ACEs, we used the International ACEs IQ score, and scores above or equals to 6 denoted high ACEs. PrEP uptake was defined as one taking any PrEP pill anytime during pregnancy all through 9 months postpartum. Part of our results, overall we included 989 women in this analysis. Their median age was 22 years, and among them, the median age at their first time of marriage was 19 years old. 92% of our women were married. 16% reported they did not consent or choose their partners. Looking at the prevalence of high ACEs, nearly a third, which is 29% of the women that were included in this analysis, reported high ACEs of scores greater than 6. Most common ACEs identified were household violence at 73%. 54% reported being orphaned or their parents divorcing. 48% reported experiencing household violence. 35% reported being bullied. Nearly 45% of the women included had high risk scores. And 22% reported taking PrEP at any point during pregnancy or postpartum. From the first slide that should be on my left, we find that women who experienced IPV more frequently had high ACEs at a p-value of 0.008, and women with high HIV risk trended towards higher frequencies of high ACEs, a p-value of 0.06. Look at the correlates of PrEP uptake. PrEP uptake did not differ between high or lower overall ACE scores, and women exposed to household violence during their childhood had 30% lower chance of taking PrEP. In conclusion, we find that ACEs were common and associated with high HIV risk and intimate partner violence into adulthood, and PrEP uptake was substantially lower among women who experienced household violence during their childhood. We find that majority of our HIV intervention programs focus on reducing HIV risk through HIV testing, behavioral intervention, and also community education. From our results, we find that it will be important to also focus on psychological risk like childhood adversities, or what we call adverse childhood experiences. And therefore, this intervention that reduces violence could disrupt pathways to HIV risk later in life and potentially improve the utilization of HIV prevention services like PrEP among this population. Thank you so much.